Good morning, everybody. Well, I read this article from NBC News, and then I sat and just thought about it for 10 or 15 minutes. Let's start out with this headline: Racial Disparities. Well, I'm going to save you the time and trouble of reading the article. The racial disparity they're talking about is black and brown, and by black, I mean the black community, and by brown, I mean the Hispanic community. Somehow they leave out the Asian community because I guess Asians just aren't a minority. Well, not one they want to cover anyway. Anyway, the racial disparity they're talking about is the one against vaccinations. They say that blacks particularly are disposed not to get the vaccine because of historical events. Like they even remember them. These historical events they're talking about happened way before better than 90% of members of the current population were born. They say that black and brown people will not be wanting to get this vaccine. This is the obstacle they're talking about. In the subheadline, without considering racial equity. Now, there's a beautiful term. Equity. Equality of outcome. Not an equal chance to obtain that outcome. It doesn't matter how bad you foul up. Everybody's going to get a participation award. You know, like socialized medicine. You may wait for years for a routine operation, but it's all equal outcome, isn't it? That's what they're going for in this equity, equality of outcome. Instead of going for excellence, they're going for the lowest common denominator. And then they talk about systemic racism in our healthcare system. Yeah, like any doctor is going to refuse to treat anybody for reasons of race. Well, I'm sure it has happened and will happen again in the future, but systemic? No, there's nothing systemically racist about our healthcare system. It's beautifully capitalistic. You can get the best healthcare in the world as long as you have the money. I'd much rather have a healthcare system like ours where you could be guaranteed great healthcare as long as you're willing to work for it, rather than a healthcare system that's completely socialized like the British, where unless you're the top upper 1/10 of 1%, well, you're pretty much screwed because you've got to go to the national healthcare system. Let's push on now a little bit with this article. Los Angeles. Despite the potential for a vaccine within weeks, distrust of the medical community by Black and Latino. You see, I told you that's what this was all about. Now, it even goes nuttier than you would like to believe. Let's go on a little bit to where a part of this story I really couldn't believe. This quote is going to come from Dr. Marcella Nunez Smith, an expert on healthcare inequality. We cannot get this pandemic under control if we do not address head-on issues of inequality in our country, she said. There is no other way. Really? You don't think this vaccine rolling out, or actually one of 3 vaccines rolling out right now, being produced in quantity, will get this pandemic under control from around the world? You really believe any inequality in the United States is going to stop these 3 vaccines from being effective? My, inequality sure is a hell of a lot more powerful than modern medicine, isn't it? And good old Gavin Newsom. He said last month Black and Latino residents who have been disproportionately affected. Yeah, because that lousy vaccine is racist. That Wuhan flu, well, you'd expect it to be racist because the Chinese certainly hate blacks, so naturally they would develop a flu that targets the black community. Here is my favorite little bit. Disparities beget disparities, she said. It's not just a matter of pre-existing conditions. People who live in dense areas where the sidewalks are very small, they don't have the luxury of keeping 6 feet distance. Wow. I had to laugh when I read that because, well, I live in a fairly nice suburb of Honolulu. 2 good-sized, healthy men my size couldn't walk past each other down a sidewalk without turning our shoulders, without bumping into each other. The only sidewalks I know of in Honolulu where they're wide enough to walk past each other without bumping shoulders are in Waikiki and downtown. So I don't know where she gets this idea of sidewalks being small as being something that is particularly exclusive to poor people. Let's finish this up at the very end of the article. This last quotation is from the good mayor of Long Beach, California, Roberto Garcia. We have to make sure this is all through an equity lens, he said. The last folks that should be vaccinated are NBA players and billionaires. Where the hell do you think he got that from?
There is something profoundly wrong when in recent years we have seen a proliferation of millionaires and billionaires.
Oh, yeah. Bernie, you should have copyrighted that.